Congratulations, your baby is here. These next few days are filled with wonder and joy and a bit of normal and healthy worry. Now is the time to take important steps to make sure you meet your breastfeeding goals. As this baby reminds us, breastfeeding is best for the baby, best for the mother, and best for the family. Research confirms that breastfeeding strengthens a baby's immune system, helps prevent childhood illnesses such as respiratory infections and gastroenteritis, and decreases lifelong illnesses such as asthma, obesity, and diabetes in the baby. Mothers who breastfeed have decreased breast and ovarian cancer, less cardiovascular disease and diabetes. They lose their pregnancy weight more easily and suffer less from postpartum depression. Families who breastfeed miss less work, have fewer medical expenses, and save money by not buying formula. Though babies and mothers benefit from any breastfeeding, exclusive breastfeeding significantly increases all these benefits. Because a woman's breasts do not feel different immediately after birth, some women worry that they do not have enough milk. Bringing baby immediately to the breast after birth, practicing lots of skin-to-skin time, and providing only breast milk, unless you have a medical problem to address, will increase your milk production and help you build a good milk supply. On day 1 and 2, mother's first milk, colostrum, contains important bodybuilding proteins and antibodies to fight infection. Since a newborn's stomach is the size of a marble, he eats only about a teaspoon or 5 milliliters at each feeding. Fortunately, colostrum is very concentrated and perfect for your newborn. Most babies experience cluster feeding on day 2. They want to eat more frequently when mother's milk is about to change from colostrum to more mature milk. Putting baby frequently to the breast will both calm the baby and build up mother's milk supply. By day 3, baby's stomach increases from the size of a marble to the size of a table tennis ball. Now baby can eat 1 ounce, which is about 30 milliliters at a time. Feedings will occur about every 3 hours or so. However, like most adults, baby may be hungrier or less hungry at different times of the day. Most babies need to breastfeed 8 to 10 times in 24 hours. A newborn has special ways to communicate that she is hungry. She might bring her hand up to her mouth, smack her lips, or wiggle and squirm like this when she is ready to eat. Early swaddling or pacifier use makes it harder for the baby to communicate those important early signs of hunger. Therefore, most professionals recommend delaying swaddling, pacifier use, and feeding with a bottle until breastfeeding is well established, at about 2 weeks of age. Many mothers benefit from a nurse teaching her how to hand express colostrum, especially if the baby is extra sleepy on day 1 of life. As shown here on this breast model, the mother first places her hand in a C shape around the areola and nipple. Next, she pushes breast tissue back toward her chest wall, compresses the breast tissue, and then releases it to express a small amount of colostrum. Hand expression will increase milk production and help if breasts are engorged. Many mothers are surprised to learn about a special hormone, CCK, that is released in both the newborn and the mother as she breastfeeds. This hormone relaxes the mother and causes a newborn, like the one we see here, to get very sleepy after nursing for only 10 to 20 minutes. If your newborn falls asleep after breastfeeding a short while, mother can put the baby skin to skin. In about 10 minutes, this hormone level drops and the baby begins to wiggle. The mother can now put the baby on the other breast to complete the feeding. During the first week, you will know that breastfeeding is going well by tracking your baby's weight and noticing the number of wet diapers and the number and color of your baby's stools. Healthy breastfeeding babies initially lose from 5 to 10% of their birth weight within a few days. Her weights in the hospital and follow-up weights at your baby's clinic visit within the first few days after discharge will confirm that your baby's weight is changing as expected. She should regain her birth weight by 2 weeks of age. During that first week, a baby typically has 1 wet diaper and 1 stool for each day of life. Parents expect to see at least 1 stool on day 1, 2 on day 2, 3 on day 3, 4 on day 4, 5 on day 5, and 6 on day 6. Obese mothers, mothers with diabetes, high blood pressure, or thyroid disease during pregnancy, or mothers who had a C-section or challenging birth might experience a temporary delay in their milk coming in. A nurse or doctor might suggest supplementing with donor milk or formula until mother's milk supply increases. New parents often wonder whether their baby is going off to sleep or just shutting down from too much stimulation. Look at this baby. Her face is relaxed. There is no tension around her eyes or mouth. Her skin color is uniform. However, the baby on the right is demonstrating a shutting down response to overstimulation. He looks like he is squeezing his eyes shut. Notice the tension around his mouth and eyes, and that the color on his forehead is not uniform. When this baby is comforted skin to skin, he will soon begin to wiggle and squirm and be ready to eat again. Family, friends, and professionals are here to help you on your breastfeeding journey. But remember, your baby can be your greatest teacher. Watching for early signs of hunger and keeping track of baby's wet diapers and of the number and color of baby's stools will reassure you that your baby is getting plenty to eat. Contact your medical provider or a lactation specialist if you have any breastfeeding concerns when you get home.